Hi, I'm James Gardner, certified athletic therapist, certified strength and conditioning specialist. I'm going to talk to you today about a tape job for the knee. One of the common things that we see in sports and in an active population is pain around or underneath the kneecap, generally termed PFPS, patellofemoral pain syndrome. Pretty much a bucket list of things can be encompassed in that. What this tape is, the application of this tape job is aimed to do is create a little bit more comfort and also potentially change a little bit of the tracking of the patella as the knee bends and as the knee extends. Common injuries or common things that lead to pain in the knee, basically being active, running, biking, anything where the knee is doing repetitive motion over the course of a long period of time. Any undiagnosed pain, always check in with a medical provider. For this tape job, I'm going to use 2 pre-cut pieces of tape, rounded at both ends, pre-cut to suit, and I'll show you the application of a couple other pieces as needed. So for this application, we're going to have the knee in a nice gently flexed position. This really shows the borders of the patella or the kneecap. I'm going to start medial or lateral, no bias on my part for this. And as we start the application, I'm going to find the midline of the kneecap up top, cross over the midline, and then basically wrap around the knee, coming down across another painful point in many runners or basketball players, the tibiotubercle, the bony prominence of the shin. So here I'm going to encompass the patellar tendon as well. So here I can lay down the heat activated mobility tape with the analgesic, so I'm getting that support as well across multiple areas of discomfort in the knee. Tibial tubercle, where that tendon tends to pull a little bit, mid portion of the patellar tendon, and then up around the lateral side in this case. Second piece of tape, just to make it symmetrical, I'm going to use the same color, almost the same length in terms of application. I'm going to overlap at the top, peel the backside. Tension you can play around with for whatever's comfortable. But really what we're trying to do is house the perimeter of the patella, the kneecap. So I cross over here, there's a little bit of overlap, which is fine. I ensure that this is stuck down all the way around, and I have my tape job complete with 2 simple pieces. If I want to further this tape job to ensure that it's staying down, I would simply apply an anchor to the bottom and potentially an anchor that comes all the way around the thigh on the top. But for this and the purposes of what we're trying to achieve, 2 pieces, no anchors necessary. It's going to adhere down, and I'll just have Ross stand up. So you can see that the tape job in standing now, there's a little bit of wrinkle, but there's enough tension here that as he moves his knee into flexion and extension, he has support. It is housing the kneecap itself. The patella is inside the tape job, supported around the medial border, the superior edge, the lateral border, the inferior border, tendon and tubercle also covered with the analgesic of the tape.